This is Dr. Antolak from the General Dentist in Shelby Township, Macomb County, Michigan. And today I would like to talk to you about what it's like to have dry mouth. Because of many medications that a lot of our senior patients are on, they have a very, very dry mouth. And that creates real significant problems with the fact that they are constantly dealing with this dry mouth and are constantly battling what to do with it and how to moisturize dry mouth. Dry mouth comes from like over 400 different types of medications can lead to having this dry mouth, what's called xerostomia. Dry mouth affects those people who are on radiation therapy, chemotherapy, those who are on medications for high blood pressure, for just about any kind of disease that you can imagine. So one thing that's recommended if you do have a dry mouth is to talk to your physician about getting prescriptions that don't lead to that, if they're willing to look into some alternatives for you. The list is kind of long, and you can look that on the internet, and you can look up medications that cause dry mouth, and it'll give you a list of those. Some things we do as a dentist are things to avoid cavities. Cavities form when people are on dry mouth because in the mouth the saliva naturally has the ability to buffer against the acidity from dry mouth. When bacteria of the mouth are there, whenever you have something like sugar or carbohydrates, it takes that bacteria and forms it in the sugar. The bacteria form an acid from the sugar. And this sugar, as it sits on the mouth and it acids there, it creates cavities or holes in the mouth. The drier someone's mouth is usually we find it's more of a rampant problem with having cavities. So what we want to do is to try to lubricate the mouth with certain different types of dental products, non-sugar-based products. So one problem we do find with that is that when people have a dry mouth, they might drink things like pop or suck on candies, or are certain types of cough drops that contain high levels of sugar. And they will come back and their mouth will be full of decay, which is really a shame. Some products that we have here at our office is something called ice chips. Ice chips are made out of xylitol. Xylitol is a natural sweetener made out of the bark of birch trees. And since it's not a carbohydrate like sugars are, the bacteria in the mouth cannot metabolize it. If they cannot metabolize it, they cannot form acid, which causes the problem for cavities. But it's a type of an alcohol, not the type of alcohol we drink, but the name of it is an alcohol. So it's a sweetener, it's a natural sweetener that the bacteria cannot recognize, and therefore it's good for diabetics because it has a very low glycemic index, and it's also very good for people who have a dry mouth who have issues with cavities. Also things like using fluoride, things like using rinses like called biotin, other things that help to lubricate the mouth are really important. So if there's any question about that, or if you feel like this is an issue you may have, and you're located in Macomb County, then we'd be happy to serve you. You can call our office at 586-247-3500 if you have any questions. Thank you. Have a blessed day.